Okay, hello everybody. My name's Jon Edmondson. I'm the MSK clinical lead on PhysioLine. We're going to look today at a bit of a follow-on from the MSK clinical lecture on exercise as medicine, but also on from the webinar that was done late last year about the best way to benefit from exercise. We've got two sections to the webinar. We'll look at general terms used to describe activity and what the current recommended levels of exercise provision are for our patients to improve their health. But first, we need to look at what the positive effects of mental well-being are. So most people set out on an exercise activity to improve the cardiovascular health, to build muscle, to look good for their holidays. But we need to bear in mind that exercise has a whole host of mental benefits. So regardless of how old you are, how fit you are, there are plenty of studies to show that exercise can help boost your brain function. So what are these mental benefits? Well, exercise has been shown to reduce stress massively. If you had a rough day at work, take a walk or take a trip to the gym, benefit from physical and mental benefits of working up a sweat to relieve mental stress. So we know that exercise increases concentrations of norepinephrine, which helps to moderate the brain's response to stress. So if you go and get sweaty in the gym, it's been shown that working out can reduce stress and boost the body's ability to deal with mental tension. Believe it or not, despite what it sometimes feels when we exercise, it also increases endorphins, which create feelings of happiness and euphoria. We have studies that show that exercise can alleviate symptoms amongst those classed as clinically depressed. Physios recommend that people suffering from depression and or anxiety put in plenty of gym time. In some cases, exercise can be just as effective as antidepressants when we're treating depression. Self-confidence. We get some exercise, look and feel better. On a very, very basic level, physical fitness can help boost your self-esteem and create a positive self-image. So regardless of your weight, your size, your gender, your age, there are plenty of studies that show that exercise can quickly elevate your own perception of your own attractiveness. So there, your self-worth increases. If we get outside, exercise in the great outdoors can also increase your self-esteem. People look at lots of gym classes, but if you find an outdoor exercise session that fits into your needs, running in the park, open water swimming, cycling. If we are fortunate enough to see the sun, vitamin D that we produce from being in the sun can lessen the experience of depressive symptoms. So you don't need to book in for a day at the spa when a bit of fresh air can work wonders for self-confidence and happiness. So more seriously, exercise can also prevent cognitive decline. Sadly, as we get older, our brains become a little bit slower. As we age, degenerative diseases like Alzheimer's affect brain cells. The brain also shrinks, which can affect our important functions. Exercise isn't a miracle cure to Alzheimer's, I'm not saying that, but it can help slow down cognitive decline that begins after around the age of 45. So exercise between 25 and 45 years of age has been shown to boost chemicals in the brain that support and prevent degeneration of the hippocampus, which is part of the brain located in the medial temporal lobe and forms an important part of the limbic system, the area that regulates our emotions. And the hippocampus is also associated with memory, in particular long-term memory, so we have a boost to the effect of the brain to remember. Anxiety. So which do you think is better at relieving anxiety, a bubble bath for 20 minutes or a 20-minute jog? I know that there'll be a lot of people out there that prefer a warm bubble bath, but actually it's the jog. It might be surprising that the chemicals that are released during or after exercise can help people with anxiety disorders, OCD, post-traumatic stress, social anxiety, or specific phobia, and it helps them calm down. So hopping onto a treadmill or swimming a few lengths for some moderate, high-intensity aerobic exercise can help reduce your anxiety sensitivity. Boosting brain power. Studies on mice and humans have shown that cardiovascular exercise can stimulate the formation of neurons, that is, create new brain cells and improve your brain performance. So we have got studies available to us that show a high-intensity workout increases the level of BDNF, brain-derived protein, a neurotrophic factor that can help with chronic disease such as cancer and speed up higher thinking and higher levels of learning. And it also helps memory, the ability to learn new things. So getting sweaty increases the production of cells in the hippocampus, as mentioned before. And researchers recently linked children's brain development with their level of physical fitness, but also that running sprints helps to improve the vocabulary retention in healthy adults. Okay, for those of us with addictive personalities, it helps to control addiction in response to any form of pleasure, whether that's exercise, sex, drug, alcohol or food. The brain releases dopamine. Unfortunately, some people become addicted to dopamine and dependent on substances that help to produce it. Exercise can help in addiction recovery. Short exercise sessions also effectively distract people from eating or people from other addictive topics. It makes them deprioritize them and helps reduce cravings in the short term. For those unfortunate to have any issues with alcohol, alcohol abuse disrupts body processes. It affects circadian rhythms, meaning that those that drink heavily, even those that drink heavily just at the weekend, find it difficult to get to sleep without drinking. Exercise can help to reboot the body clock, and it helps to return a normal sleeping pattern. It helps us relax. For some, a moderate workout can be the equivalent of a sleeping pill, even for those with issues of clinical insomnia. So moving around 5 to 6 hours before bedtime raises the body's core temperature. So as we rest, and when it drops back to normal a few hours later, the body reads this as a signal to sleep. And it also helps us become more efficient at work. A study that I read recently showed that workers who take time for exercise on a regular basis are more productive and have more energy than those that are less active. Yeah, it might be difficult to fit exercise into a busy schedule. It might be difficult to justify a walk when you're meant to be at work. But research has shown that a walk at midday is the ideal time to exercise due to the body's circadian rhythms. Following exercise, most people have a shower, but maybe we should concern ourselves with tasks requiring creativity. So a gym session can increase creativity for 2 hours. It's supercharged by linking it with outdoor work and interacting with other people. And be an inspiration. Get out and exercise. People exercise better when they're paired with somebody else. It might be competition or not wanting to let others down when you're meant to be arranging to meet for a particular exercise session. But working with others can help to increase pain tolerance. It helps people push themselves harder, and it helps us feel better. So what do these terms mean? Well, physical activity, exercise, and physical fitness, they all seem to link in together, but they describe different things. They're often confused with one another, and this is an attempt to distinguish between them. As you can see, physical activity is defined as any bodily movement produced by muscles that results in an energy expenditure. It's a very scientific term, and the energy expenditure can be measured in kilocalories. Physical activity in daily life can be anything. It can be occupational, it can be sports, it can be conditioning, it can be household activities, whereas exercise is a subset of physical activity that's planned, structured, repetitive, and as a final or intermediate objective of improving movement or maintaining physical fitness. So physical fitness is a set of attributes that are either health or skill related, and the degree to which these people have these attributes can be measured in specific tests. And these tests are offered as an interpretational framework for comparing studies that relate physical activity, exercise, and physical fitness to health. So, as well as the mental benefits that we've just discussed, the physical benefits are well reported. As we all should be aware, physical inactivity has a significant impact on rates of illness and death, which leads to an economic burden on healthcare systems and wider society. Inactive people spend, on average, 37% more days in hospital and significantly use more healthcare resources than active people. Where it comes into our particular service within Bupa, if we have healthy people, they don't access the costs of treatment. and therefore it's more beneficial to Bupa as a business. Many factors influence physical activity, and meaningful change, as we know with the start of the new year, require sustained efforts across multiple systems. Healthcare is one system, and integrating physical activity promotion into healthcare is one of the best ways of reducing elements due to physical inactivity. So within Bupa, as a healthcare provider, it's important that we positively influence the health through the brief time we get to spend talking to our patients. Physios, lifestyle coaches, nurses, and helpline staff are all in a great position to promote physical activity. As an example, there are over 51,000 physios working in the UK, covering 5 million outpatient appointments. That's within Bupa and within our external clinics. Within Bupa, Physioline cover around 800 telephone triage appointments every week, which means we've got 40,000 potential people that could be educated around physical activity and exercise. But there's very small evidence in research to demonstrate the provision of exercise within medical practice, and it's quite frightening that a few studies suggest that exercise provision within physiotherapy is quite low, which leaves exercise to relevant personal trainers, which haven't quite got the link with the clinical aspects of any kind of diagnosis. Whereas a physical activity intervention requires staff to have a knowledge of current guidelines, a lot of the guidelines are still not quite clear. Specifically, healthcare professionals must determine whether a patient is in a high-risk category, how to make the current recommendations most effective for that patient. And I read a study of physiotherapists in 2013 that reported that only 51% of physiotherapists knew the current physical activity guidelines. But what are the current recommendations for exercise? How many minutes of moderate intensity physical activity is recommended per week per adult? How many minutes of vigorous intensity physical activity is recommended per week? And how many days per week is it recommended that adults undertake strength training? Now, it used to be, with the American College of Sports Medicine, that it was 3 to 5 times a week, 15 to 60 minutes a day, between 60 and 80% of heart rate. And that's moved on since they were set in around about 1990. If you take a short while to think of what your answers would be to consider the current recommended level, I hope you would be surprised to hear that in 2013, only 23% of the respondents, the physiotherapy respondents, were aware of any guidelines for physical activity administration. So, what do you think? Well, current recommended levels, it's expected that 150 minutes, so 2.5 hours of moderate intensity physical activity recommended per week for adults, anything under 60% maximum heart rate. How many minutes of vigorous intensity physical activity is recommended? So 75 minutes. And surprisingly, 2 days per week are recommended that adults undertake some sort of resistance or strength training. Now, all professionals working in healthcare should make themselves aware of the benefits of exercise, the physical benefits and the mental benefits. But assessments of physical activity status and signposting to relevant professionals should occur at all our healthcare assessments. More methods of exercise provision should be made available to maintain health and the physical activity levels of our members, and therefore help to promote health within the wider society. Right. Thank you very much.